Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Dan Rubenstein. He is the CEO of Physera. So it's good to have you with us.
Good to be here. Thank you for inviting me.
Okay, so for those who are not familiar with Physera, so you guys are a little bit of a darling of a startup here. Got a big investment last year from BlueCross BlueShield Ventures, right?
Yeah.
10 million, I think, total, right? Total funding. Eight from them.
No, $6 from them and an $8 million. $6 from them and an $8 million round. And we did a 2.8 million seed a couple of years before that.
Okay, and so what you guys do, if I'm understanding this correctly, is you're kind of disrupting the physical therapy space, but it's not exactly physical therapy. It's musculoskeletal therapy, right? And so what is the difference?
Yeah, so I think one thing that people don't realize is if you look at musculoskeletal pain and conditions, it's actually one of the largest cost drivers in our healthcare spend in the country.
For those who may not be familiar, what kinds of conditions are these?
Yeah, so this is everything from knee pain to back pain, neck pain, shoulder issues, and it runs a whole gamut of seriousness from minor sprains to chronic pain, and we address full range.
Okay, and so you are bringing, if I recall correctly, you're bringing these therapies to patients, members of a health plan or an employer-sponsored health plan, via their phone. So the different exercises, and then they can also reach out to a practitioner as well. Is that right?
Yeah, so what we do, we have a nationwide network of doctors of physical therapy that are employed by us who meet with patients remotely through their smartphone in a video consultation. They diagnose what's going on. They also do a triage. So God forbid there's something more serious that's not just simple back pain. They will refer you to the to the correct care pathway. And actually one of the reasons I started the company was because of what happened to my father, who was complaining of lower back pain and was misdiagnosed by his primary care physician as having sciatica, a pinched nerve. And after 9 months of taking ibuprofen, we finally convinced him to get a second opinion. And it turned out he actually had stage 4 lung cancer that had metastasized to his bones. He was not a smoker, no lung cancer symptoms. But it really brought home the learning there that primary care physicians are not generally musculoskeletal experts. So it's really important to have someone who is a deep musculoskeletal expert involved in the diagnosis part up front.
Okay, so these are the types of doctors that you employ and make available through the platform.
Correct.
Okay, so tell me a little bit, I guess, about the business model, how this all works. So you work with an employer group or you work with health plans. Tell us a little bit about your client base and how you're reaching their client or their patient base.
Yep. So it's actually complicated in the healthcare system because you have...
Really? Yeah. You're kidding me. That is a shocker. You heard it here first. Okay, no, go ahead.
I'm sure you hear it all the time. So we work with what I would call risk-bearing entities, so people who actually pay the bills.
Okay.
And who are they? It's the health plans or it's large self-insured employers. And they love our program because it helps them preempt unnecessary spend around surgeries, opioid prescriptions, unnecessary imaging, and even specialist and primary care visits. And we do that by getting up front, intervening in the care pathway with a musculoskeletal expert, one of our doctors of physical therapy, who can diagnose up front and then either guide you through the right pathway or treat you through our program directly.
Okay, and now I'm going to ask about the people who pay for this, and I'm going to ask about specifically paying. So it sounds like, I think our inclination is, I'm going to see a specialist first. This is going to be more expensive. So is it more expensive, or are you guys proving that if you follow the patient journey all the way through, it's actually less expensive?
Yeah, we designed the program from the ground up to align incentives between payer, patient, and provider. So our program is priced at a flat fee. And it's only for the people who use it. So it's not like we're charging employers, PM. We only charge for the patients who enroll in our program. And it's priced to be competitive with in-person physical therapy care. And it's actually, when we first started the company, we were wondering, could we build a program that's as good as in-person PT? And in many ways, what we've discovered is that we've built a program that's better than in-person PT.
Why? What's better?
Adherence.
Okay, so tell me about that.
Yeah, so the biggest problem with I don't know if have you ever been to PT yourself?
Yes, I have actually.
What
and
happened?
Eventually it's like I can't make these appointments. It's ridiculous. There's 3 a week or whatever it is, and I couldn't get over there.
Yeah, and most PT clinics usually give you a piece of paper with the exercises, and you're left to your own devices and time to do it. And the biggest challenge is most people don't do their exercises. It's like your 8-year-old kid in his piano lessons, right? They never practice between lessons. And so our program is actually designed to monitor patients in between when they're supposed to be doing their exercises. We have an app with a rich library of animated exercises. It's actually one of the most popular apps on the App Store under physical therapy. If you search for physical therapy, we're one of the most popular apps. We make our app freely available to anyone who wants to use it for the exercises. It doesn't come with a PT connection. That's only available in the enterprise version. But we have this rich library of animated apps. animated exercises that people can follow along and do. And then most importantly, we monitor each patient every day remotely. So we see when you don't do your exercises, and then we proactively reach out to you to help you stay on track with your program.
And that's really where the like you said, most people fall off, and that's really what makes the difference in the long-term, wellness of the person involved. I want to ask about a little bit of the wellness of your business. So give us a sense of where you guys are at. So we started out, we were talking about the big round that you guys had closed about a year ago with BlueCross BlueShield Ventures. Where are you at? How many customers do you have? How many people are using the service? Can you give us a sense of utilization rates? Where are you at?
Yeah, so I think what was very interesting coming out of the tech world into the healthcare world, I was previously at Google and Facebook with my co-founder. I think healthcare moves like a battleship, right? So the inertia is slow, but once you get momentum...
Some might say it's sinking, actually,
no. I think there's actually a lot of, especially at this conference at Health, where we're both at right now, there's so many interesting companies out there. I think the future looks bright. Anyways, once you get momentum, and we're very fortunate to get BlueCross BlueShield venture partners to invest in us. We've had a number of Fortune 500 and Fortune 100 employers launch with us in the past 2 years. Some of them have brought us to their health plans and asked us to integrate with their health plans. So we're in final contracting with a couple of health plans, a large regional health plan, and also a national health plan that we will be rolling out with in 2020. So the momentum is there. The patients love it. We're getting incredibly high ratings for our program in terms of outcomes, the pain reduction, functional mobility, adherence, all very high.
Okay. And how are you guys? How many people are you? Where are you located? Are you guys, you've just closed that round, but everybody's always like, I'm still fundraising. Where are you at?
Yeah, I think the reality is startups never stop fundraising, right? So they either just close the round or they're laying the groundwork for the next one. Mm-hmm. So we're based in Silicon Valley. Mm-hmm. We actually have offices. We are a remote first company, so it's actually something interesting that coming out of companies where people were distributed across many offices at Google and Facebook. With something that we really wanted to do at our company too is hire the best people wherever they may be. So we actually have a critical mass in Minneapolis as well, and staff members distributed across the country, many of them working from home in some cases.
How many?
So we don't disclose our numbers.
Oh, come on.
It's
more than go ahead.
Less than 100, but more than 20.
Great, thank you for that.
Talk to me next year and we'll be...
Oh, okay, sure, yeah, okay. Okay, good. All right, so we have a sense of where you guys are at. Now, forgive me for asking this kind of late in the game here, but do you have the same restrictions as other telehealth providers in terms of licensing around different parts of the country? So you said you're rolling out with a nationwide health plan provider. Are you guys scaled up for that, or are you going to be doing a little bit of work laying that groundwork?
No, we've been around for 4 years as a company. And it took us that's a heavy lift to comply with all the state-by-state regulations. And we're very proud of the nationwide network we've established. Mm-hmm. We have professional corporations in the states that require it. All our PTs are licensed in the states in which they treat. Do I wish that it wasn't that way? Yes.
Yeah, you and everybody else in telehealth.
but now that we've done it, I'm actually grateful for we've done something difficult and we're proud of it. So
awesome. Well, exciting to hear your news. We'll have to look for that at the beginning of the year, these big health plans that have signed on. Congratulations.
Thank you so much.
Awesome. It's great to talk to you.
Great to talk to you.
I'm Jessica DaMassa with WTF Health. Thanks for joining us.